this is the straight leg raise, and then we'll also go into the iliopsoas and tensor fascial lata performance tests or strength tests. So for the straight leg raise, it's going to be both active and then passive. So I want to see how she does it first, and then I'm going to take her through it as well. So the first thing is we want her toes pointing towards the ceiling. We want the opposite leg to stay flat. And we want her to lift her legs straight up into the air as far as she can tolerate. And you can see there's a little bit of a knee bend there. And so as we watch, I don't think she quite gets to 80 because I'm saying that her knee is bending, okay? So what we also want to watch is the greater trochanter. So if you do that again, I want to be palpating to see, is it going to translate anterior or superior? And as I feel, go ahead and do that one more time. It feels actually pretty good. But we want it to rotate like it's on an axle and a tire's rotating around it, right? So it's staying in one spot and it's not gliding. That's called PICR. Okay, so I'm going to go around the other side. And I'm going to passively do it. And I'm going to feel for that first resistance, which is about right there. Okay, so just so you can see, that's not quite 80 degrees, so I can't passively get there. So if she can't actively do it, I can't passively do it, we're thinking that it's probably a posterior chain problem, or it could be a hip joint problem. Now, if your patient's actively doing it and they feel pain in their groin, you can do it passively with like a posterior glide or putting pressure on the inguinal ligament. So just so you can see, I'm going to be on this side. Typically, I'd be on the other side. I'll try, maybe I will do it this way. But as she goes up, if she feels a pinch here on her own, then I'm going to let her relax. I'm going to provide a glide here, basically that inguinal ligament or posterior glide, and then I'm going to passively do it. And if that feels better and I can go further, then what we know is the posterior hip structures, like the hip extensors and the posterior capsule, might be too stiff or short, not allowing that posterior glide to occur. So then it takes a passive least resistance and glides anteriorly, causing a pinching in the front. So when you press down, you create that posterior glide and you can reduce pain. So that's when we would press on the inguinal ligament. It's not always completed. It's mainly if there's just pain in the front of the hip, or you notice a translation superior or anterior. So that's a straight leg raise. So you can transition pretty quickly into the tensor fascial lata performance test and the iliopsoas. So if we abduct, flex, and laterally rotate, I'm going to see, can she hold that? Can you hold that position? So that's pretty hard for her, but she can do it. And I'm going to press down, don't let me move you. So I'm going to press down, and it's very hard, right? So I'm not going to put a lot of pressure for her, but we're thinking that iliopsoas is most likely weak there. Now, let's say she tests weak way up here. Again, I'm in abduction, flexion, external rotation, but I lower her down about 10 to 15 degrees. And all of a sudden she tests strong here. That tells me that the iliopsoas is long. Next, if we do the tensor fascial lata, so I'm going to be abducted, flexed. I'm going to medially rotate. Can she hold this? Can you hold that? I can see her pelvis move. We'll go ahead and relax. So it's very hard for her. She can barely hold it, right? So I'm not even going to put pressure down. But if they're stable there and they can hold it, then I can put pressure to test. So I would say, again, TFL is probably a little bit weak. Again, if she's weak up here, but I lower her down 10 to 15 degrees and she's much stronger, that tells me the TFL is long. Okay, so can you hold this position? That's a little bit easier, but still tough. Go ahead and take a break. So that's the iliopsoas and TFL strength or performance test.